Thank you so much.
Thanks.
You can see my presentation, I hope. Okay.
Yes, yes, we can see
I'm
it.
going to look at food system transformation using diet quality as an entry point, and then make reference to food environments and where it actually fits in. In terms of introduction for key messages, I'm going to share work that is being done in Ethiopia to develop food-based dietary guidelines, and then look at lessons within that work, and emphasize the fact that diet quality should actually be both an input and an output of the food system. In the work that's been done in Ethiopia, we started with diagnostic work on diet quality. The work is led by an Ethiopian PhD student who is a staff member of the Ethiopian Public Health Institute, where the project is actually housed. In terms of the diagnostic work, it took into account the lack of data, which is a problem that many African countries face. So only one national consumption survey was used, which was done in 2011. And then to complement that, we used World Bank Household Income Expenditure Survey to look at nutrient supply at the household level. We looked at the Global Burden of Disease report, extracting Ethiopian data to look at the health perspective. And then that was complemented by literature reviews on the supply side, on the food environment side, and on the consumer environment as well. And then we took sustainability considerations as well. In terms of briefly the kinds of picture that we've got is that there are multiple burdens of malnutrition that the food system must address, and that diet quality using food-based dietary guidelines can actually be helpful. So stunting has been going down, but has stagnated, is slower now. We have both undernutrition and also overweight and obesity. Micronutrient deficiencies are highly prevalent. In terms of the consumption survey, and although this survey was done in 2011 on the left there, the picture hasn't changed much. You can see the nutrient-dense foods that you want to increase consumption with and promote with food-based dietary guidelines are actually not being consumed. But at the same time, on the right there, you can see that affordability is also an issue. And then the other thing that complicates things is that the food system itself is actually not able to provide nutrient-dense foods affordably. Looking at diet quality further, this time using minimum diet diversity and minimum acceptable diets for children. To the extreme left, that is Ethiopia, we are now at 12% being the proportion of children meeting their minimum diet diversity. It's gone up. In the previous recorded one in 2010, it was 4%. But then I've included Ghana in there because with Ghana, the previous survey showed a higher proportion of children meeting minimum diet diversity, and that has gone down in the most recent survey. The idea here is simply to show that even when we seem to be making progress with diet quality, we have to keep looking at what is going on to be able to mitigate, because the progress does not happen only in one direction. And then for Ethiopia, so what we've done is there are 3 clusters of activities to the work developing food-based dietary guidelines. The diagnosis is what I described earlier. And then the food systems innovations is where we are dealing with issues around food environment, looking at assessing and supporting ongoing interventions in the food system. But one of the reasons of looking at the food environment is actually to avoid trade-offs and build synergies. because it's clear that knowledge alone of what one needs to eat is not enough, and that what is happening in the food environment can influence what you eat besides the knowledge that you have. And then for the cluster of activities 3, here what we're saying is whatever knowledge we come up with, the evidence we generate, we need to anchor it within the policy environment to start with. And that was the reason for selecting the Ethiopian Public Health Institute for the project, but also to anchor the work in terms of capacity. And here we are working with Ethiopian students in local universities to actually do some work. We give small grants for them to do food systems related research. And the idea is to anchor food systems perspective in the research that is happening in the universities. So this is one example of a specific project on food environments that is part of this work on developing food-based dietary guidelines. And the objective was to identify influencing factors of adolescents in terms of their dietary choices in urban Ethiopia. And specifically, they looked at 2 schools. Now here, essentially, the main findings were that even though the participants had good knowledge of food safety and hygiene, this did not translate into health food purchasing. And the reasons that they give is issues around they perceived the environment around which the food was being sold to be unsafe, and so they preferred to buy sweetened sugar and potato crisps and the like, even though they knew that was not the best thing. So essentially is to say that even when we are developing food-based dietary guidelines, once we have those guidelines, we have to take into account these environmental factors in the dissemination of those food-based dietary guidelines. Otherwise, they will not be helpful. And I think the speakers earlier, somebody's talking. And the speakers who spoke earlier about the study that has followed Ghanaian migrants is a good example of how the food environment can actually influence the outcomes in terms of nutrition. Now, in terms of Ethiopia, then back again, we should then work backwards from diet quality. If the diet quality is poor, we need to go backwards and look at what's happening in terms of consumer choices, what's happening in terms of the environment, and also back through to the supply system as well. And this must really focus a lot also on the food environment as a critical component of the food system that must be addressed to avoid trade-offs in terms of nutrition and health outcomes. For the earlier work that I gave, so what I have colored green text now on this picture is areas that have been addressed by different projects, and therefore showing that we are actually looking at a food systems perspective, trying to create synergy across different projects to do so. And then going back to my key messages, this is my slide, Michelle. We are using diet quality through the process of developing food-based dietary guidelines to identify points of entry for food systems transformation. It has been possible to identify challenges in the food environment, especially the example that I've given is the study on adolescents, but there are also others that have been done. And then diet quality really needs to both be an input in terms of showing us what we need to do in our food system, but also an output in terms of the fact that the food system should be supporting better quality diets in order for us to address the types of trade-offs that we see. And then, of course, sustainability considerations need to be a part of that. Thank you. And over back to you, Michelle.